Today, we'll be discussing about prevention and control of hypertension. Results have shown that it is not only older people that are having these conditions now. Young adults have started developing hypertension, which is becoming more prevalent among young adults and undergraduates. Obviously, the youth are becoming more prevalent to these disease conditions. Meanwhile, hypertension, raised blood pressure, or high blood pressure is a situation whereby there is a persistent raise on the pressure that comes on the blood vessels. Either one is excessively agitated or too expectant. But today we'll be talking about how to manage, control, and prevent these disease conditions.
I never expected it.
First, I'd like us to discuss about the dietary control. Like the word goes, garbage in, garbage out. Every human body responds to the value of good nutrients that get into the body. It is believed that the entire system of an adult requires just 2,300 milligrams of sodium, which is salt, per day. And for known patients with hypertension, they are only required to take less than 1,500 milligrams per day. It is important to eat good diet that are free from too much of sodium chloride, that is called table salt. Again, DASH diet. These are diets that are predominantly magnesium, sodium, and they are basically from fruits and vegetables. It means the volume and the value of fruits and vegetables that we take has a way of controlling and helping to prevent hypertension. Again, consistent and regular exercise. Activities like simple routine jogging, simple routine road walks has been proven to be one of the major variables that help in preventing and controlling hypertension. It has equally been proven that those that have excessive body weight are very prone to hypertension, and those that have tummy fat are very prominent to having hypertension. It is very important that diet, exercise that is tailored towards controlling body weight is given proper attention. When you put your diet in check, you exercise regularly, you are going to put your blood pressure in check. And for those that are already having hypertension, you need a coach that guides you on certain exercise that can easily help in controlling and regulating your blood pressure. One other point that is very essential that help in preventing and controlling hypertension is reduction in alcohol intake. It has been proven that excessive consumption of alcohol has tendency of increasing the heart rate, which in turn increase high blood pressure. It is important again for those that want to prevent or that are already having hypertension to quit smoking. Excessive consumption of tobacco has been proven to be a major chemicals that have tendency of increasing the heart palpitation and increasing blood pressure. For one to be able to control hypertension, manage stress, and should be able to embrace stress-free work, monitor your blood pressure regularly. It is important that you have a blood pressure kit at home for regular check and monitoring. It is equally very essential for you to have a routine visit to an healthcare provider or to go to the hospital and clinics regularly and seek the counsel of an healthcare giver concerning your blood pressure at every point you visit the hospital. It is important for everyone that want to prevent or control hypertension to reduce the intake of caffeine. Caffeine has a tendency of giving a spike to your blood pressure. It has been proven that it is not regular or consistent or something that can stay for a very long time. But if the patient is already having hypertension, it can bring a persistent rise or spike in your blood pressure. It's also important to note that medication is key in control of hypertension. Every one patient that has been diagnosed for having hypertension is important to take their medications regularly and consistently. No patient should stop their medication except you are advised by your healthcare giver or by your medical doctor after checking or knowing fully well that it is not needed. But again, it is very wrong for any patient that has been diagnosed for having hypertension and is already on medication to quit. My name is Dr. J. I hope this helps you.
Like, subscribe and follow My Health by Dr. J for more health videos.
See you in my next video.